you walk through the garden, you better watch your back. Well, I beg your pardon, walk a straight and narrow track. If you walk with Jesus, he'll save your soul. You gotta keep the devil down in the hole.
For children and teens who live in Baltimore, Maryland, they face the problems of crime or having incarcerated family members, one of adverse childhood experiences. As measured by Data Resource Center for Children and Adolescent Health and Baltimore Child Abuse Center, the likely cause of these problems is families, communities, and education. These problems result in early death, risky health behaviors, low life potential, and chronic health conditions. Since the year 1980, incarcerated rates have risen dramatically within Maryland. Not only are the number of adults incarcerated increasing, but the number of impacted children and families affected is increasing as well. 90,000 children in Maryland affected by this problem. They lack bonding experiences within families. In addition, the transition from incarceration back into society and family presents many challenges. Difficulty finding a job leads to more financial troubles and additional stress.
In 2015, the number of inmates sentenced in Baltimore City was estimated to be 6,000, and the number of inmates under parole and probation is around 12,000. Based on the Bureau of Justice Statistics report, children from 30,000 households have incarcerated parents in Baltimore City, and this household has a total of 4,636 children. As for inmates under probation and parole, children from 6,400 households are affected, and the total number of children is 9,300. In sum, a total of 14,000 children in Baltimore City have an incarcerated or supervised parent, representing 3.5% of total children population in Baltimore City. Because the criminal activities are concentrated in certain communities, some communities suffer from a high percentage of children of incarcerated parents. Up to 11% of total children in one community can have one parent incarcerated in state or federal prison.
The arrest and dismissal of a parent from a child's life forces that child to come from emotional, social, and economic consequences, which could cause behavioral problems. This could lead to earlier death, risky behaviors, low life potential, and chronic health conditions. The incarcerated parents' members lose their job, and it is hard for them to keep a living. They feel hard to get involved in the family again, while their children have negative attitudes to accept them. The public is also judging them based on their imprisoned experience. Incarceration overall costs a lot, and the prisoners have trouble get back to society. So the jail should try to reduce the incarceration and the rate of return to prison. Since higher rate of incarceration tend to occur among residents of neighborhoods already ravaged by poverty and heightened police pressure, the effect on children's education and income as they grow into adulthood creates a circle of lacking opportunity and resources for entire communities. In school, those children's negative at-risk behaviors not only damage the study environment, but also cause the threats for other students. Children need school counselor, class teachers, school staff, and principals to help them. Children and family cultural and racial identities are important components in understanding social's view of incarceration and criminal behaviors. Government has the incentives to build a stable society and have a better young generation.
We identified 5 current approaches, each addressing the needs of our 6 stakeholders. The Angel Tree program is a prison fellowship program that helps children to get involved with each other, learn social skills, and restore relationship with their incarcerated parents. The Sesame Street Workshop created an incarcerated parent tip sheet to educate prisoners about how to be a good parent. The Baltimore Child Abuse Center provides free medical treatment and mental health support to children who suffer from sexual abuse, human trafficking, trauma, and other adverse child experiences. Rainbows for All Children collaborates with schools and local community centers to provide free programs to children from all economic, racial, ethnic, and religious backgrounds, with assistance to deal with the loss of parents due to divorce, death, deployment, and incarceration. The Department of Public Safety and Correctional Services of Maryland facilitates a series of programs that helps incarcerated parents to maintain better family relationships during imprisonment and prepare successful re-entry to the family and community in the future. Although there are already various types of programs existing to help children with incarcerated parents, there are still unmet needs of our stakeholders. First, the access to the programs are limited. It is difficult for families and children in Baltimore to access some of the above-mentioned programs geographically and socially. Second, missing one family member is similar to missing one source of family income. Therefore, the families with incarcerated members would like to reduce financial burdens through other ways. Third, there is not enough school involvement in the current programs. Fourth, the current programs have low awareness among the families and children. Fifth, the current programs are lack of stickiness. Starting with Johns Hopkins University, within 5 years, our innovation solution is to establish clubs in colleges and universities around the Baltimore area, with the mission to help children with incarcerated parents. Our vision is to help relieve children with incarcerated family members from trauma and provide them with easy access to engage in their communities. Our value proposition is that, with the university's involvement, the awareness, continuity, and stickiness to the program will increase. Moreover, college students could learn from the experiences while helping and guiding children in need.
Johns Hopkins 4-Children Club will have a full committee structure. 6 committees operate under the board of directors, and each committee consists of a mixture of board members and non-board volunteers. Governance and Development Chair Committee, Finance Committee, Communications Committee, and Human Resources Committee will be labeled as supporting committees. Operation Chair is responsible for the High School Committee and Junior High Committee. The 2 committees will form relations with high schools and create programs. Activities in programs are prepared by several committees under the event chair, such as the Sports Committee and Mentorship Committee. The club will form a matrix organizational structure for programs in schools. Volunteers from the high school committee or junior high committee, along with those from several committees under the event chair, will work together to provide programs in high schools. Each school has its own assigned work group, and members from the high school committee or junior high committee will act as coordinators in charge of activities and developments.
Johns Hopkins 4-Children Club is a pilot program that focuses on helping children with incarcerated parents from Mergenthaler High School and Robert Poole Junior High School. There are 3 major sources of club funding: university funds for school clubs, fundraising, and donations from local businesses and individuals. All funding will be used in renting facilities and equipment for activity usage and purchasing food accommodations and household supplies for children. The club's general activities are displayed here on the screen. After 1 year of pilot run, we will expand this initiation to other colleges around the Baltimore area. By sharing our experience, we are aiming to help them create their own clubs to help children with incarcerated parents.
Students with different skill sets are the club's main resources, and students from Johns Hopkins will consist the majority of our volunteer group. Communities around the high schools will also be our resources as they will provide funding and fields for activities. The immediate outputs of the activities for participants will be less pressure and better schoolwork grades. The activities will be good opportunities for them to connect with peers and to reduce their pressure from incarcerated parents and families. In the long run, participants will have better physical and mental well-being. Their condition might not be as good as those without incarcerated parents, but volunteers will do their best to improve participants' chances to live normal lives. The club's goal is to minimize the negative consequences for children with incarcerated parents, and that is also the ultimate impact. With help from volunteers both within, such as donors and restaurants, and outside the community, the living conditions for these children will improve and they will also have better lives than before.
The first step in our implementation plan is establishing the Johns Hopkins for Children Club. Our team members will initiate this student organization by writing a proposal of our visions, plans, and financing requests to the university. We plan on registering our club through Johns Hopkins Center for Social Concern. Our second step is recruiting new club members within Johns Hopkins University. We'll bring in volunteers by marketing to students and staff around campus. Our third step is setting up regular club activities and meetings, outreaching to community organizations for collaboration, and seeking for volunteer opportunities. Our fourth step is marketing plan. Contact the principal or administrator of the high schools and middle school and pitch our business plan for our club and organization. Step number 5 is creating and executing a plan of action for volunteers to meet and spend time with the children and teens. In our sixth step, we ensure program longevity by reaching out to other universities around the Baltimore area to market our mission and encourage them to form their own clubs. The first month of interaction can be our guidance and mentorship toward them and their club to get them up and running and teach them the do's and don'ts. And lastly, our seventh step is in order to keep children and teens involved and coming to these meetings, we must create and form bonds between the kids and volunteers. This will allow them to create a positive connection to a role model figure by continuing to create a fun environment with incentives to have them coming back.
We estimate that 3.5% of Baltimore children have incarcerated parents, 10.5% have supervised parents. We divided children into 3 age groups: primary school students, middle school students, and high school students. With our college-level volunteers, we will target high school and middle school in the Baltimore area. We believe the market and our target population are large enough and have the needs for us to serve. All our funds and fundraising campaigns will go through the approval process and get approved by the Center for Social Concern. Also, it is done directly through the Give Pause page. We will contact our staff advisor prior to fundraising to ensure we can receive deposit funds in a timely manner. Since we are working with 1 high school and 1 middle school in the beginning, our coordinators will firstly use Johns Hopkins Engage platform to contact those schools and also contact other Baltimore colleges to approve the university tours. Because our club is working with the minors, to avoid potential issues, all club volunteers must complete the Working with Minor requirement checklist in Hopkins group. Club members are also required to follow the university student policy, student conduct code, and all undergraduate and graduate student organization policies and procedures.
Stuck in no man's land. Ain't nobody on your way back. Ain't nobody gonna lend you a helping hand. And you start breaking down, and you go to the sound. But you hear